Hello everyone, and welcome to your first clinical quarter here at Rasmussen College. Again, my name is Carissa Legg, and I'm going to be your lecture instructor for the next 11 weeks. So each week I'm going to put up a new video going over some of the chapter topics for this week, or for that week. Please remember though that just because I do the video doesn't mean that you do not have to read your work. You should always be reading your chapters. So let's go ahead and get started. So for Module 1, we are going to be focusing on 3 chapters. We're going to be focusing on Chapter 1, Chapter 2, and Chapter 59. So let's go ahead and break into each one of those and talk about the different pieces associated with each chapter. So we're going to start with Chapter 1, which is medical assisting the profession, so kind of the backstory. So medical assisting has really evolved or developed due to the fact that there have been rapid changes in healthcare. Oftentimes we are referred to as kind of the jack of all trades, specifically because we can handle a variety and a wide variety of different tasks, and we can perform many different things. Medical assistants used to be trained on site by providers, but now the training for that has really changed. However, we do still work under the physician license, but we have to be trained a little bit more thoroughly and more formally now. Because of the formal training that is now needed, the MA was formed in 1955 to help providers with that formal training. And the MA stands for the American Medical Association of Medical Assistants. Now, in order for you to receive certification, you have to enter into a program that is accredited through one of 2 programs. It is either accredited through the Commissions of Accreditation for Allied Health Education Programs, or another way that we put that is CAHEP, or you have to go through a accredited program through the Accrediting Bureau of Health Education Schools, ABHES. We here at Rasmussen College are ABHES accredited, so you can be sure that you are now part of a program that you need to be in order to sit for your medical assisting certification. The MA is a national certifying agency with headquarters right here in our backyard of Chicago, Illinois. They offer what we call the CMA, or the Certified Medical Assistant Exam, which is what you will be receiving at the end of your schooling here. Now, once you are certified through MA, there are some rules that you need to follow. First and foremost, you must complete 60 CEUs, or continuing education units, in 60 months. So every 5 years, you're going to have these 60 CEUs. So even if you did a few a year, 12 a year, once a month, you would actually make that requirement. And that's 60 months from when you become certified. So if you got certified in June of 2017, you would have until June of 2022 to have that certification completed. Now, if those are not met, you will need to retake your CMA certification exam to recertify yourself. Once you become certified, you can work in one of 2 capacities. You can work in either a clinical or an administrative background. So let's take a look at each of those differently. So when you're working in an administrative areas, you have some different responsibilities than you do in a clinical setting. Your administrative responsibilities are things like scheduling patients, accepting co-payments, sending out bank statements, handling some of the mail and insurance claims, dealing with collections if that is needed. So it's more of the front end things, where your clinical responsibilities are more what we call the back end. Those are things such as obtaining a medical history, performing lab tests, obtaining vital signs, controlling inventory, preparing medications or administering medications via injection, or even helping the provider during some sort of procedure. So all of the things that you would do on the back end are more clinical responsibilities. All right, so that's going to be a brief wrap up for Chapter 1. Let's move to Chapter 2, which is talking about the history and the practice of medicine. So medicine, it has been in existence for a very, very long time. As long as there have been disorders and injuries, there have been doctors. And some of the first doctors were known as what we call medicine men, or they were also considered shamans or witch doctors. But one of the most important people was a man called Hippocrates. He is known as the father of medicine, along with a couple of other really important individuals. This chapter goes on to talk about people such as Galileo, Ben Franklin, Louis Pasteur. Beyond just having famous men in history, there were also some famous women. People such as Clara Barton, Florence Nightingale, and Elizabeth Blackwell. So it's really important, and I would tell you guys, please make sure you're reading through and reading about those important people in history. But one person I really wanted to point out was Hippocrates and how important he was for medicine. He's actually the one that kind of started it all for us. With Chapter 2, we also talk about how allied health professionals. Now, as medical assistants, we technically fall under this title of allied health professionals. But before we consider some of the specific professions, you'll need to know and understand the different terms such as certification, licensure, and registration, and knowing the difference between those. So certification means that you're issuing a certificate and credentials by a professional organization to someone who has met the educational needs and experiences of that organization. Exactly what you guys are going to be doing to get your certification. You're going through a program, you're getting the education, you're getting the experience that you need, and then you will sit for some exam at the end to get that certification. A licensure means that a government agency has the authority to give individuals an occupation. So you have to go through a governmental agency, not just a professional organization. And a registration means that a professional organization has been given in a specific healthcare field. You take an exam, and then you're put on a list of qualified individuals. And each year you'll have to re-sign up on that list. So know that each year you'll have to pay onto that list, where licensure and certification, you can go 5 or more years before you have to kind of re-up that. All right, so that's kind of my brief overview for Chapter 2. Let's finish it with Chapter 59, which is talking about professionalism. So healthcare professionals need to have good technical skills and soft skills. Beyond having just these skills, there are other very important skills that you need to possess. Things such as teamwork. Being a team player shows that you have initiative and you know when to jump in and help others when it's needed. You need to be proactive or a self-starter. And you have to know how to manage your priorities. So this means having good time management skills. Making sure that you are persistent. So that means that you're able to stay on a task longer than usual when it's necessary. You don't give up. So beyond knowing your soft skills and your effective skills, all these other skills are things that you will learn throughout your time here at Rasmussen, and we're going to help you as your instructors know and use those skills the best that you can. Okay? Beyond having those skills, you need to be able to have a professional image. So regardless of a dress code, you should always project a professional image. You always want to make sure that you are wearing clean, pressed clothing. Clothing should not reveal your breasts, waist, tattoos, or underwear. You should not have any artificial nails, and they should be kept short, your original nails, because they can harbor bacteria and are really inappropriate for most offices. Watch your jewelry, because excessive jewelry can also harbor bacteria and get in the way of providing good health care. Making sure that you're brushing your teeth, hair, and not using any strong perfumes or deodorants is really important as well. And making sure if you have longer hair that you tie it back, because you don't want it to fall into a clean area. It can then become contaminated, and then you bring that home with you, and that's not something that we want. Now, the last thing I want to talk about is communication. And communication is really between anyone in the office, a patient, a provider, a nurse, a janitor, a front office assistant. Anyone that you communicate with can fall under this bracket. But communication is not just what we verbally say, it's also what we write in emails, in sending out referrals, putting it in patients' charts. Anytime that there is some sort of written work, that's also a communication. So here are some brief rules that I like to give people in the verbal and nonverbal sectors of communication. So in your written work, you never want to use text abbreviations. No BRB or YW. I know that a lot of my friends do that, and it drives me crazy. You should actually be writing those words out. Be accurate about what you're saying and use your professional language. You're not at home with your family and your friends, so make sure what you're saying is professional. On the opposite side, with your verbal skills, you want to make sure that you're actively listening. I was told once that we sometimes listen to respond instead of listening to actually hear. So make sure when you're listening to people, you're actively listening. Speak so you can be understood. Enunciate your words. No marbled garble that will make it hard for people to understand you. And seek to understand. Again, going back to that active listening. Don't seek to reply. Seek to actively listen and understand what your patients are saying to you. All right, guys, so that is kind of the overview that I have for 1, 2, and Chapter 59. This week, you do have you have a discussion post due and a quiz. Your initial discussion post will be due on Tuesday, April 4th by midnight. And you need to have at least one reply to a classmate no later than Saturday by April 8th. Now, what I want you to do first, before you start doing your discussion board, I want you to head over to the General Course Questions section. If you watched my walkthrough video, you know where to find that. And that's going to actually give you some tips and tricks and tips and pointers on how to create an effective and a correct discussion post. Look at some of the examples that I have there, and then make sure you're reviewing the rubric for how I will be grading your discussion board, so that way you can actually get the best possible points for yourself and for that first grade. The other thing that you do have this week is your first quiz, which is over professionalism and boundaries. This is a quiz that will consist of multiple choice or true-false questions. It is 20 minutes long, and you will have a 20-minute time limit. This will be due no later than Sunday, April 9th by midnight. Now, if you do have any questions, guys, please make sure that you are reaching out to me either via course messaging or my phone that links directly to my on-campus phone. It's on your homepage right where you would see my picture. So please make sure that if you do have any questions or concerns, you reach out to me right away so I can help you the best I possibly can. I look forward to an awesome 11 weeks with you guys, and welcome to week 1 of your first clinical course here at Rasmussen College. Bye, guys.